Thank you, Chancellor. Chancellor, Vice-Chancellor, distinguished guests, members of the University, graduands, ladies and gentlemen. I pay respect to the traditional and original owners of this land, the Muwi-Nina people, and pay respect to those that have passed before us, and I acknowledge the Tasmanian Aboriginal people who are custodians of this land. Thank you to the faculty and for your kind words and introduction. It really is a great honour and privilege to be able to address you all today. I wish to recognise and congratulate all the University of Tasmania graduates on your stellar performance, your enthusiasm, dedication and resilience, which today has led you to your own individual achievement. Now, there's a lot of Type A personalities in this room, I'm included, so I'd like you all to take a deep breath, inhale a sigh of relief and savour the moment. Congratulate yourself on this tremendous day. Reflect upon all the dedication, determination and true grit which has led you to this moment. To the teachers, lecturers, mentors and role models, congratulations on your contribution to this fine graduating class of 2021. I also wish to particularly acknowledge the delighted spectrum of partners, parents, children, siblings and friends of this fine group of graduates. It is so wonderful to see so many smiling faces in this room and the excitement. Someone once told me that choosing a career in healthcare is not a sacrifice, but it's a choice. This may be true in the pre-COVID world, but today I would like to recognise the sacrifice a lot of you graduates, partners and family members have made to achieve your goals. You did not sign up for closed borders, separation and restriction of normal life, and I admire your tenacity and bravery. To the graduates who will be entering the workplace in clinical roles or research in the coming months, your seniors and supervisors may be afraid of your youth and inexperience. However, we should be afraid of you. You University of Tasmanian graduates are the future of healthcare and medical research. You're up to date, you're highly skilled, you're enthusiastic to tackle whatever the future may hold for all of us. Now, although there is a well-trodden path for new healthcare workers, do not be afraid to spread your wings and reimagine your skills in unique settings to diversify and create worlds of work that yet do not exist. Technology will re-advance several paradigms ahead, and we rely upon you to help us move forward. Medical innovation and reimagining historical treatment pathways in bioengineering and research is the reason I am standing here today. So let me take you back to a hot summer's evening 12 years ago when I first graduated. I was working at the LGH on my first rotation as an emergency department intern. I admitted an 80-year-old ex-war veteran who had severe aortic stenosis. Now, this is a life-limiting valvular heart disease condition of ageing. And this gentleman was in four-minute end-stage heart failure. It was his third admission that month, and due to his age of 80, he had already been declined surgical aortic valve intervention, which at the time, in 2009, was the only definitive treatment available not just in Australia, but worldwide. I treated him with all I had at the time, which included oxygen, diuretics and morphine. I watched his wife hold his hand and he died. Now, just 12 years later, thanks to the innovation, enthusiasm and foresight by a Frenchman named Professor Alain Cribier from Rouen in France and his bioengineering team, this problem can now be safely treated via keyhole techniques through the groin with patients fully conscious and avoiding the need for bypass machines and open cardiac surgery. Most patients who undergo a transcatheter aortic valve implant, or TAVI as we refer to it, go home the next day and often avoid hospital admission for many years. These patients have a substantially improved life expectancy, but perhaps more importantly, an improved quality of life. At the Royal Hobart Hospital, my team and I do this procedure for 2 to 3 elderly patients every week, and in the 12 years since I was sitting in your seat, close to 1 million patients have been treated worldwide with a TAVI procedure. For you research graduates, since 2009 there's been 12,000 publications with over 1/3 original research manuscripts on the subject, according to PubMed of late last night. I was fortunate enough to recognise TAVI as a panacea and what it can provide to our Tasmanian patients and our community. I was fortunate to have a University of Tasmania degree which allowed me to work and learn from the most experienced clinicians locally and internationally to attain enough clinical experience to run a program in Australia independently. All of this would not have been possible without my degree and without the generosity of a University of Tasmania scholarship kindly bequested by Dr. M.G. Cesar and his wife. This provided my family and I with the most wonderful cardiac fellowship in London. I will be forever grateful for this opportunity, and as of last Friday, this innovation has been used to treat over 125 patients within the last 18 months. Future projections suggest we will be treating up to 200 patients per year in the coming decades, particularly as Australians continue to recognise the multitude of benefits of living in Tasmania. Now, why do I tell you all this? Well, it's to illustrate how fast interventions change and will change in your professional life as a healthcare professional or researcher. This story is to motivate and inspire you to all find your true path, your contribution to your respective fields, in order to advance the care of our patients. Now, with only 12 years of experience, it's hard to try and impart wisdom, particularly with such an esteemed faculty, but I'll try nonetheless. And I will highlight for what I see as the 5 pillars of excellence in the workplace, and this includes all workplaces. These 5 facets include the role of communication, respect, humility, teamwork, and civility. It is a privilege to be involved in the lives of people from all walks of life who trust you implicitly and value your every word and opinion. Do not let them down with poor communication. Learn how to talk to people and engage all. Come up or down to their level, avoid jargon, and be fastidious in the use of interpreters and visual aids where appropriate. What you may not have realised just yet is that some of the most important conversations in your patients' lives are going to be delivered by you. Please recognise the impacts of your words will affect the trajectory of the patient or family member, even when for you that interaction might be the last clinical job of the day when you are fatigued and you just want to go home. This is going to be even more challenging in the foreseeable future when communication needs to be performed behind an N95 mask. Respect your patients, respect each other. There's no place in healthcare or research for bullying, abuse or discrimination. Humility in healthcare is allowing for a partnership with your patients as opposed to a historical hierarchy. Almost all excellence in workplace settings is dependent upon teams, and teams work best when all members feel safe and have a voice. Patient care is becoming more complex, and I guarantee there will never be a day in your career when you do not require the help of another healthcare professional in the treatment of your patients. You are never alone, so do not be afraid to ask for help or advice. And it's important to remember that these things will become much easier as your experience grows. And finally, please be civil. Cohesive civility between team members creates a sense of safety and is a key ingredient of success. In contrast, incivility and hostility robs teams of their potential and has been proven in many studies to make patients feel uncomfortable with their treatment and has been shown to lead to poorer clinical outcomes. In closing, I'll impart some wisdom given to me when I was a medical student by an eccentric yet brilliant psychiatry registrar. He explained to me the 3 key requirements that a person needs to achieve happiness. And it's fairly simple and includes the following. An individual needs, and by an individual I mean you, requires something to do, someone to love or be loved, and something to look forward to. I think in times of trouble or doubt, remember to prioritise these 3 values, and hopefully it will lead you to a brighter path. It is my great pleasure on behalf of the respective healthcare professions to welcome you as new graduates, employees and colleagues. Look after each other, enjoy your night and good luck.